Now, total knee replacement is done as a permanent treatment or a long-term treatment of severe osteoarthritis or rheumatoid arthritis or severe arthritis of the knee. Here what happens is that the patient not only has pain but also very limited mobility. They find even small tasks like going to the washroom a huge issue, a huge problem. What happens is the lining of the joint gets worn out, the cushions inside the knee called the meniscus, they get worn out, there is deformity in the joint and limited movement in the joint. So many people, after a trial of initial conservative treatment, would suggest a total knee replacement. For total knee replacement, the patient has to be reasonably fit for surgery and should have a positive attitude for a good recovery. It is not nice to push for a total knee replacement when the patient is actually not ready for it. There are a lot of myths about total knee replacement within the public at large, and this is my biggest challenge. Many patients would prefer not to have surgery, and this is totally understandable. But when I ask them why they don't want surgery, they come up with all sorts of answers that really amuse me. There is a myth within the public that once you do total knee replacement, the knee cannot move, they are in bed for months, it is extremely painful, and there are many complications. In fact, nothing can be far from the truth. Modern day surgeries are very safe, providing we select the patient correctly, we optimize the patient's health before surgery, and the patient is well informed before surgery. So this is what we specialize in. We have a routine called prehabilitation, which is what the patient goes through prior to surgery. They meet a physiotherapist, they meet our anesthetists, they meet our physicians, and they get to understand what the surgery will involve. So here, simply put, the knee is cleaned. It is not a replacement. In fact, it's just a resurfacing. We put a cap on the femur, we put a cap on the tibia, and we replace the meniscus with a polyethylene spacer. So this is what it looks like after surgery. In fact, I'll show you on this model, which is better. So this is a cap. You can see there's a cobalt chrome or an alloy cap, which is about a few millimeters thick, and this lines the end of the joint. This replaces the cartilage on the femur, and on the other side, top of the tibia or the shin bone is cleaned up, made flat, and a block sits on top of the tibia, which is made of titanium or cobalt chrome alloy, and it sits on the flat of the tibia, on top of which we put a cushion which replaces the original meniscus. So when these two come together, they form a joint, and then the patient can move the joint and walk relatively normally. Compared to the partial knee, this is a much bigger operation. The recovery is a lot quicker, a lot longer. Sometimes there is some blood loss and patients might need a blood transfusion. They tend to have a little bit more pain after surgery than a partial knee replacement, and generally it takes 2 to 3 months before the patient is really happy with that knee when compared to a partial, when the patients are walking within 2 weeks without any crutches or without any walking aids. Traditionally, the total knee replacement has been recommended for most people with advanced arthritis. But as I said, we limit this to about 40 to 50% of our patients needing surgery, as we feel that only advanced cases involving more than one compartment should get a total knee replacement.